Hello, I'm Catriona Waitt and I'm a reader in Clinical Pharmacology at the University of Liverpool, and I spend most of my time in Uganda where I'm doing my Wellcome funded research. Pregnancy and breastfeeding is often one of the most hopeful and joyful times in a woman's life, but around half of women worldwide require some form of drug during pregnancy or lactation, and there often isn't accurate information to reassure the women of the safety and the use of that product during that time of life. The reasons for this have been that traditionally women have often been excluded from research. So if you think of any clinical trial, the number one exclusion criteria is often pregnancy or breastfeeding. And the reason for that, of course, is that we've been very aware of the need to protect the unborn child and the newborn from any unwanted risks. However, it's increasingly recognised that to use a medication off-label when it hasn't been tested in the population where it is to be used and where there aren't adequate data, that itself brings risk. And as we move to an era where we make informed choice with our patients, how can we make informed choice with a patient when there is no evidence-based data on which to form that choice? So there's been quite an ethical shift from protecting women from research through to protecting women through research. And that's the type of work I'm involved in here in Uganda. So there are different ways we can get the information. We can do observational studies where a woman requires a treatment for her own health, and then you invite her to donate samples for pharmacokinetics, for example, blood samples, cord and maternal blood samples at delivery, placental samples, breast milk, infant samples. Or, in some situations, we can do clinical trials in pregnant women. And of course, each drug, each situation does require a very careful assessment of risk-benefit ratio, but it is possible to produce high-quality evidence to inform dosing and safety for drug use in pregnancy and lactation.